Now that we've gathered some fascinating insights, it would be a great time to summarise and discuss what we've heard so far. Here we have some fantastic questions lined up. Are you observing a shift in consumer demand towards holistic health approaches?
Yes, almost certainly. So the market is constantly evolving. It changes all of the time. But I think at the minute, people are definitely wanting a holistic approach to wellness. They want invisible treatments. Whilst there'll always be a place for our injectables, people are really wanting to look at their wellness, their well-being, and looking at their longevity as well.
How is your clinic adapting to these changes in consumer demand?
I think with anyone in my industry, we're constantly learning and evolving. So it's about keeping up to date with new advances in technology, looking at how we can improve the holistic care of our patients. For example, with these patches, they've made a huge difference to the health and well-being of my patients. And it's about making sure that my whole team is on board with that approach as well. So with every encounter that our patients have with myself and my team, they're getting good, consistent advice. So we're all embracing the same approach to wellness.
What are the most pressing challenges you encounter in the aesthetics industry?
I think there's lots of challenges in the aesthetics industry. The market is very much saturated, but I feel that that's a bit of a race to the bottom and something that I hope not to compete with, but also something that would always be mindful of and always never be complacent in this industry. So we always want to learn and be better. We might not be the best, but we can aim to be up there amongst the best. The regulatory challenges are huge, and I think they're about to get worse or better, depending how you view them. But hopefully that will make the industry a lot safer for ourselves and, most importantly, for our patients. But there are huge financial challenges and lots of competition. So it's really important that we look at how we can differentiate ourselves from other practitioners within the market.
Are you witnessing an increase in competition within your market?
I haven't noticed this too much within Durham. So I think we have a lot of aesthetic practitioners opening up. I don't think we have many doctors in my area. Perhaps I'm just fortunate with that. Or perhaps my clinic does differentiate already and set us apart from that. But it's something that we can't be complacent about. We've always got to be mindful of competition. I think competition is a good thing because it keeps us on our toes, it keeps us learning, it keeps us evolving as well.
Have your clients' needs evolved in recent times?
I think what we've noticed in the last year or so is a change from dermal filler. Patients are wanting to look at natural treatments. They're wanting to look at how they can rejuvenate themselves naturally, but not just in terms of structurally in their face, but also internally. So their well-being in terms of diet, nutrition, how they approach their wellness, their pain relief. And we've had a big shift in the sales of patches within our clinic. It's a product that's gone down really well within our clinic. Patients always talk when they're having treatments, and the key skill in clinic is listening. So we're in a perfect position to listen to their needs. So when they're talking to us about their back pain or their menopausal issues, we're in a prime position not only to help them with those symptoms, but actually have additional services available within our clinic setting.
What strategies does your clinic employ to differentiate itself from its competitors?
I think my clinic is about providing the best care possible. So as I said, we might not be the best, but we aim to be up amongst the best, and we can always be better. So it's about looking at how we can evolve to find out what our patient needs are. And at every touch point within the business, the patient should feel that their best interests of their health, well-being and aesthetics are being assessed and embraced, and that the decisions are based not on what we can sell to them, but how we can improve that not only their aesthetics, but their health and well-being. And I think my whole team embraced that at every point across the business.
Are you observing encroachment of the wellness industry into the aesthetics market?
Absolutely. This is a huge shift happening at the moment. The wellness industry is massive in terms of dietary supplementation, um, how we can help with menopausal symptoms, how we can treat pain, how we can improve our aging, how we can regenerate naturally. It's a massive shift in the market. And I think as an aesthetic medical practitioner, it's something we either move with or we get left behind. So it's something that's going to evolve. It's evolving now. I think it's going to continue over the next couple of years. So something that we need to embrace and move with it.
How can clinics make the transition to integrate wellness services into their offerings? And where would you recommend them starting?
I think these patches have been a great starting point for me in my clinic. We're well placed listening to our patients. They all talk, they have a confidential environment where they chat while they're having their treatments. They talk about the various issues that impact on their lives. They'll talk about how they're struggling with their menopausal symptoms. They'll talk about their pain. They'll talk about how difficult it is to access their family doctor. So we're very much well placed to listen and see how we can help them. And I found that the patches that I have in clinic from Access Healthcare have been well taken up by my patients. And I think most of them come back and buy more. So it's a great starting point because we can help with pain, wellness, anxiety. We can help with bladder symptoms, menopausal symptoms. And we've had great results with our rejuvenation patches as well, as a sort of add-on and addition to our injectable treatments as well. So they've been a great add-on to our existing clinic services.
How successful was this approach in increasing customer engagement and sales?
I think it's been a great approach because it gives patients a reason to come back into clinic as well. So they'll often start off with a single patch to try them, and very much seeing is believing. So if they try them and they work, then they come back into clinic. So it's a great opportunity for them to engage and come back into clinic again.
When considering supplements for your clinic, what factors are most important to you?
I think for me, introducing supplements, it's important that there's a good evidence base behind anything that we use. As well as an evidence base, the products have to be safe, but they also have to be effective. I think if patients are going to buy and engage repeatedly, they need to have a positive experience with them. And that's something that we've had with these products. The other thing that's been vital for me is the support and backup that I've had from the team at Access Healthcare. So it's very much great to be able to have a team that you can ask questions about. If I've got any queries, it's great to have that supportive team behind the face of the business as well.
How do you choose specific products to offer your customers?
I think it very much depends on your patient, your client base. I think my target patient group, my typical patient group is 45 plus. And as we know, that age, that's when things start to go downhill. So not only does the face start aging, but the body does as well. And this is when people start to experience early premenopausal symptoms, perimenopausal symptoms. It's where we start to get aches and pains and backache.
So, Dr. Marsden, where do you think CBD fits into the analgesia market?
That's such a great question. And I might bring Dr. Sharif into this as well, because as a doctor, we're absolutely over a barrel with analgesia for our patients. So we've got patients with chronic pain, and it's a huge issue. Emma mentioned earlier the issue of back pain in this country. It's a huge market, and we've got patients that are suffering. So we've got our current options that are available. We've got our opiates, so we've got codeine, tramadol, and our morphine derivatives, and all of the associated problems from constipation, tolerance, dependence, and abuse. And then we've got our non-steroidal anti-inflammatories, where they're irritant to the stomach, causing gastritis and ulceration, and also the effects on kidney damage. By the nature of the aging population, the patients that generally need analgesia have usually got multiple comorbidities. So it's an absolute minefield to negotiate our way through. Have you had any similar experience in general practice, Dr. Shree?
Yeah, that's exactly right. What you've said, Dr. Marsden. That's the experiences that I've been seeing in general practice. With so many people now having chronic pain and, the issues with tolerance, the side effects, people are wanting to know what other options there are. And, adding pills to their already, polypharmacy and the pill burden they already take. They are wanting to know what else can be done about their pain and other ways of managing it that isn't just typical pharmaceutical options like opioids or NSAIDs, especially with the side effects that they bring. So that's really interesting what I've seen as well. It's a thing similar to what we're talking about.
And I think it's really great to have an option that we know works well and is safe and well tolerated. I mean, the data shows 69-70% of patients had a noticeable improvement in their pain control. I mean, that's massive. And it's great to be able to give them an option that we know will make a difference to their quality of life.
Considering your customers who purchased Opti15 supplements, do you believe they are more or less likely to increase their lifetime value at your clinic?
I think I'm a bit traditional and I don't like to think too much about the lifetime value of my patient. But what I like to do with each of their presentations in clinic is make a best decision. So for their best options and on their holistic care. So how can I improve their well-being? How can I improve their aesthetics? Inevitably, the supplementation increases their number of points that they're visiting clinic, and it does give us more opportunity to invest in their well-being. So I think the supplement market certainly will, it's a natural side effect that we improve the lifetime value of our patients.
Dr. Marsden, what do you think the advantages are of using a patch?
I think the benefit of patches are huge. So if we go just from the simplistics of swallowing pills, a lot of patients are actually hopeless at swallowing pills. They're actually hopeless at swallowing them. They're actually hopeless at remembering to take them. So with a patch, a once-daily patch, we've got improved compliance. They'll often have them by their bedside, putting them on once a day, not having to remember regular analgesia during the day. I know from the studies that with a patch, there's increased bioavailability of the drug, and that's because it's not reliant on absorption through the stomach. It bypasses metabolism from the liver, and you just get a nice steady state of the drug. So huge benefits of the drug, of the patch, not only from ease, but also from the bioavailability and the benefits of the drug itself.
Thank you, Dr. Marsden. So, Dr. Sharif, what is CBD?
That's a really good question, Izzy, and I think that's what a lot of our consumers want to know as well. So CBD is a naturally occurring compound that's found in the cannabis sativa plant. There's lots of evidence out there that it can really have a positive impact without giving that psychoactive high that other compounds of the cannabis sativa plant do. So the way that CBD works is there's different receptors all in your body, lots of different networks that send signals everywhere, and it works on modulating those receptors. There's some in your brain, and that's called CB1 receptors, and there's also CB2 receptors in your gut and in your bone. And all these receptors look at different things like mood, memory, pain reception, inflammation, pain modulation. So CBD works on these receptors and improves those things. And there's evidence out there to say that people have had really positive impacts with CBD.
Is CBD safe to use?
So there's a lot of evidence out there to say that CBD is safe to use, and the World Health Organization have released reports as well to say that it doesn't seem to cause adverse harm and it has no abuse potential. Topical preparations, again, have an advantage, like Dr. Marsden was saying, as it bypasses the metabolism and it's generally well tolerated by consumers.
Is it legal to use CBD?
So it is illegal to use, but there have to be certain criteria that are met. So the Home Office in 2021 released a statement saying that it had to be derived from the hemp plant and it has to contain less than 0.2% of THC. That's the compound that causes the psychoactive high. So as long as it meets those requirements, then it's legal to sell and use.
So have you seen an increase in demand for aesthetic clinics for supplementation?
That's a really interesting question, Izzy, and the answer is yes. It kind of probably started at the same time that myself and Dr. Marsden started talking, and since then, what we've noticed about 12 months, what we've noticed over the course of the year, an increasing amount of clinics are reaching out to us, aesthetic clinics that are wishing to start stocking supplements and particularly patches. And these range for, clinics wanting off-the-shelf products such as Opti, or wishing to white label. And then obviously a lot of the clinics, obviously white labeling has their own challenges because you've got to bring everything in-house. But to answer your question, we are seeing a lot of companies and clinics contacting us. I would say from the beginning of the year, maybe we would have 1 or 2 inquiries a month, and now we're getting about 5 to 10 inquiries every week coming in. So yes, it's something that we've noticed progressively getting more and more over the last 12 months, and I only see it increasing more and more. I think of all the inquiries that we tend to get, I'd say the majority of the ones that are coming through are now from the aesthetic clinics.